All right, it looks like everyone is joining in. I'll give everyone a couple of minutes so that their audio connects here and they are able to all file in. But welcome in, everyone. Thank you so much for attending our virtual dental implant seminar. I do have some housekeeping items to go over before Dr. Omar gets started with everyone today. And the first thing is that the seminar is being recorded. So I did want to let everyone know that in advance. That is to help us improve these seminars for everyone in the future. And the next thing is that everyone's microphone and cameras should remain off and muted for the entire presentation. And this is just to ensure that we are able to stay on track with time tonight and have Dr. Omar be able to answer all of your questions. And the last thing is that you will have questions. I'm sure you will. So as the presentation goes on, if you have any questions, please make sure to put those right into the chat. And Dr. Omar will be happy to answer those either right away if he's able to and it's pertinent to the topic, or towards the end of the seminar, he will make sure to get to all of those questions. And as we get started today, I do want to make sure that everyone is aware of why we're here. Today's purpose is to leave everyone with some great content in regards to dental implants and what Signature Smile does and how we can help you, and to answer some questions that you have in regards to dental implants. So we hope that you will be able to take home some useful information today in regards to dental implants. And we do want to make sure to answer all of your questions. But I did want to ask, first of all, you can type into the chat, why have you joined in today? What is your purpose for being here? And what would you be looking for during this seminar? So if you are able to go ahead and type that right into our chat, then we can go ahead and see all of those answers. And Dr. Omar will be starting soon today. Okay, thank you. Lee Smith said they're missing teeth. So we will definitely go over some ways that we can help with that. Lainey said, I want to have a dental implant for my upper. So thank you so much for sharing that. Dr. Omar will definitely be able to go over some information in regards to dental implants and how we can help you. Rob Clifton said interested in full mouth implants, or at least the upper. So that's wonderful. We definitely will be focusing on full mouth implants for today's dental implant seminar. Stephen Moore is asking how affordable. Dr. Omar will definitely be going over some information about generalized costs for the dental implants that we offer and the different types and pros and cons for those. And David said, I want uppers too. So yes, we will definitely be going over and focusing on specifically today those full mouth implants. And Laura's looking for the price for full mouth. Thank you so much, everyone, for utilizing the chat here today. I'm glad that you have been able to find that without any issues. And Dr. Omar should be getting started here soon to go over all of those questions. Will he discuss any insurance and how that would contribute? He will probably be discussing insurance and how that contributes towards dental implants with the office. Paula said, I am missing teeth and want to find out about the whole implant process and, more importantly, how expensive they are, because I know they aren't cheap. Thank you so much, Paula. We will definitely be going through a little bit more about the implant process and, again, the type of implants that we have, and going over all of those things that might be important for you. And if you have any additional questions throughout the seminar, if there's something that you feel Dr. Omar didn't answer for you, definitely let him know. He will be able to go ahead and answer those questions for you. And Dr. Omar should be unmuting and starting video here soon.
Thank you, Misa.
Of course.
Hello, everybody. And I always look forward for these evenings with everybody. And this is our monthly seminar. And as Misa was saying, The purpose is to add a lot of value. And thank you for texting back all of what you're interested in. That actually usually help with how I try to zoom in and what's benefit you. And I want everybody to leave today with all of their questions answered. So as I'm actually talking today, usually we try it's an hour. Usually I try to do it like 35 minutes, and then we leave, or 40 minutes, then we leave the last 20 minutes for questions. And I always like smaller groups, like 12 or 10 and 12, which was fantastic, so we can actually answer as many questions as possible. So let's get started. And as I talk, if you had any question, just let me know, and I would answer it immediately as well. So let's go here. I think everybody can see my screen right now. Correct. Sorry. All right. So just this is me. It's been a dentist for 20 years, just FYI, so you know who you're talking, who you're talking to. This year will be 20 years of dentistry. I my training, my extra training and residency at Nashville, Tennessee, at Meharry College, and at the Cleveland Clinic, my second year of training. I had a mastership and a diplomat of the ICOI, International Congress of Oral Implantology, one of the highest leading dental implant boards in the world, actually. I'm a teaching faculty at the Resnick Institute, one of the leading institute of training dentists how to place dental implants. And I'm a part-time instructor at the Cleveland Clinic for the residents, and part-time also for the Metro Health residents as well. All right. Let's go. This is the team. We're a family practice. This is my brother, Issa, Seim, my sister, my friend, and Dr. Noor also. She's a long-term family friend as well. So let's start about dental implant. Why dental implants and why we're doing dental implants? Actually, today I had a patient who was actually in your seat 2 years ago. She attended a seminar 2 years ago. I saw her last year and she came back today, and I'd like to share her story because it's very close to the story that we see all the time. She lost her teeth in 2010, thinking that she would have a denture. Had dentures, she didn't get used to them. Then she ended up actually trying to get some dental implants. Unfortunately, they completely failed. And she's left at this point with an upper and lower full dentures, no bone in her jaws on the top and the bottom. And 15 years later, I saw her last year, and we had a plan, but it's a major investment at this point because it's a failure implant from somewhere else, and now we're trying to recover from it. She doesn't have much bone in the structure, which is the foundation. And today we were discussing the teeth, and all what she said, I just want to be able to eat again. She's like, I can't eat. I can't, smile if everybody's judging me outside. Everywhere I go, the way I'm 50, she's 54. She just turned 54. She's been struggling with this for the last 15 years. And she's like, it's just, I can't live like this for the rest of my life. That's what dental implants do. That's why I like personally dental implants part of dentistry, because we can take this person and within a year and with a full plan, we can get her to the position where she's confident. She's not much self-aware of every time she smiles, of everybody looking at her outside. She can eat whatever she wants. And that's good for another 20, 30 years. That's why we like dental implants. So this is the exact story happened in 2016 that I usually share, but I just shared the story. Extractions. This lady, actually, she was planning to commit suicide. 3 years, no teeth. That's how much she was like so self-embarrassed. She couldn't leave the house. She visited multiple dentists. This is a letter. This is the first message she sent to us. She's like, I have dentures. They look like a donkey, and they're not working. And if you can just help, and that's not the person we show her, but that's what we like dental implants. This is quickly. We can take you from 0 to 100, within days, and get you to the position where very stable, very, very, very nice. On the right, we see Scott over here as a police officer. I mean, we went from, the nice thing about Scott, for example, and we see that usually in men more often, in men all the time, is they shave once we fix their teeth. When you look at the photo before and after, the difference is they shave. The reason why we have, facial hairs just to cover up. Same thing for, Erica on the left. She used to actually have injections just to cover her lips. and smile. She's young. Yeah, she was like 36 years old, single mom. She wanted to make sure that she had the confidence that she wants. And that's why we like dental implants. Oh, he's a neighbor of mine. Okay, wow, that's amazing that you know Scott. Good, I like that. He's a great guy. We love him. So, all right, that's amazing. Good guy. He's really a great guy. I love Scott. And all right. So this is actually the letter of the lady who wanted to commit suicide. And this is her husband saying, thank you guys, you changed it. This is 2016. Thank you very much, Dr. Omar. You guys give me the gift of life for my wife. So that's why we like this. And this is her actually this is her first steak bite. She take a steak. You know, once we finish the teeth, we always say, want to give you beautiful teeth, but more important is to function. That's why we have teeth. That's why God gave us teeth, is to look nice and function. You can eat with them. And this was actually her first bite in 4 years. She was even, she's trying to cut the food. We always say, we never finish treatment till actually you go to eat a steak and be able to chew it. This was actually her first bite. I mean, you could see how amazed she's like, oh, I can finally chew. All right. I don't want to take much time here. Let's talk over here. So the lady I saw today, she's 54 years old. And the main reason she does look, unfortunately, like 74 years. Just for a simple fact that when we lose our teeth over here is we start losing our jaw structure. And the only thing that maintain the distance between the tip of our nose and the tip of our chin is actually the teeth. The second you lose them, everything collapses. And if you lose your teeth, your body says, why do I need the jawbone? Just like if you don't use it, you lose it. So it actually starts getting rid of the jawbone immediately. And in that way, that's why we look older once we lose teeth, regardless of our age. So part of the aging process, whether we lose teeth early or not, is we start sinking in, cheek sinking in, structure is gone. And the longer we wait to replace teeth with dental implants, the bigger the problem. So if I seen this lady on the photo here, you guys look at age 45, she just lost her teeth. I still have some structure that I can work with. If I seen her 10, 15 years later, okay, maybe it's a bigger issue and it will be major rehabilitation to be able to recover from this damage. Okay. So that's exactly what I'm looking at. Look at this, the collapse of the front two teeth. All right, look at this patient over here. I mean, it's a beautiful lady. The only thing that we changed, this is 6 months apart, these two photos, is the teeth. And she just looks younger. Her eyes is different. I just amazed by the before and after photos. And by just changing the teeth, you feel like this is just a new, different person over there. So let's talk quickly about single implants. I did notice at the beginning when Misa asked that question, most people are mainly looking for main implants. But this is what single implants, if you're interested about single implants, you can just text me so I can spend more time on them, is if you're missing a tooth, we just go inside the bone, we put a titanium post, that's how it looks like dental implants, and then we put a tooth on the top of it. In the mouth, it looks completely natural. So it looks completely natural. That's how it looks in the x-ray. And once it's healed, really, if you just maintain it very well, these implants should last for a long time. As far as you maintain them well, they should last 20 plus years. And we always like to say forever, but 20 plus years is a very long term. We talk about that in a second. So that's what single implants are. Most people we usually see in seminars or even in our practice, they are usually 45 plus years. Do we have any person here younger than 45? It's okay if you can share. I'm okay if you don't share, but even if you can put your age here, that would be nice. Usually at age 45, and most people feel ashamed about it. Like, oh my God, I'm 50 and my teeth are breaking. And guess what? I mean, you had these teeth at age 10, 7 to 10 years. That's where you get your teeth. So you've been using these teeth for 40 years. It is okay to have damage. We see it all the time. People coming at age 50, 45, 55, doc, you know what? I'm sick and tired of root canals, crowns, and cleaning, deep cleaning, blah blah blah. Just every time I fix it, it breaks. That's okay. We get to the stage that the teeth been maintained with your dentist, with your general dentist for quite some time, and you're getting to the point it's over fixing these teeth, and the teeth is just wear and tear on them. It's almost like driving a car for 300,000 miles on it. And if you think about it, we live longer now. And the average age for a woman, I believe in the last study was 89 years old, and the average age for a man is 83 years old. So it's just we lived longer. 50, 60 years ago, the average age was way less than that. We're in the 60s. So the question is, at age 50, you still have another 30, 40 years to go. Okay. I'll come back to your question later. Are there only full or singles, or they can be made as partials? We'll talk about that in a second. I'll come back to your question. All right, so that's before and after, just quickly. That's where we can move things. Let's keep going here. Now, this is a very important slide, and I want everybody to stay focused with me. Keep sending questions. I love the questions, and I'll make sure that I get to them either through my talk or at the end. So this is an important function slide. So if you think about from 0 to 100, 100 is full power. You had natural full teeth, all of your teeth in your mouth, and you can chew whatever you want. You're 18 years old, right? And 0 is basically having no teeth. You're gumming your food. You cannot even chew. You cannot eat. So if you have a set of dentures, you're usually around 30%, or 30 out of 100, 25 to 30. So the best made denture in the world, upper and lower dentures, their capacity to function or to generate a bite force is 25 to 30%. That's it. So if you get dentures, if you have dentures or planning to get dentures, you need to realize you're going to be at the maximum capacity. That's at the best is 25 to 30% out of your normal capacity. So that's number one. Number, two is, I'd like to ask the question, you can put it in the chat, how much you rate. If you can eat a steak comfortably, that means that you're at 55 to 60%. This is the guideline. So if you can eat a steak without any issue, you're probably looking at 60%. If you had to cut the steak into cutting small pieces, chew it slowly, you're at 40%. If you had to eat, you cannot eat a steak, that's less. So just throw your number in there. If you can eat whatever you want, no problem, but you just hate your smile, then you could be at 90% function. So if you throw a number. So now let's look at this. What are our options with dental implants, and what can we achieve with dental implants? So the first option, I have to take my teeth out to eat, which, as you can imagine, isn't healthier either. Plus, if you're at a restaurant, how are you going to do that? I mean, you're going to take the teeth out to eat. That's not good. 50 to 60%. So, okay, that's good to know. And Rob, how old are you, if you don't mind sharing? So 50%. Okay. So let's talk about 45 years old. Wow, you're 45 years old and you're at 50 to 60%. So if I'm thinking about your teeth right now, and I'll take you as an example, if you don't mind, if only God knows how long we're going to live on this earth. But if we plan things to live till age 90, 95 years. That's kind of the plan, and if I'm going to go for another 10 years for you at 50 to 60%, if you do nothing, if you're at 55, you're probably going to be at 30%. That makes sense for you because it's just things going to continue to deteriorate, unfortunately. And the goal is to get you back to at least 70+% minimum. I'd like to get you to 70+%. So let's now talk about dental implants and how they can come handy of this. So we have few options about dental implants. And the first option is what we call, the best option is to keep our teeth, right? But yeah, things could happen. I lost a tooth last month. I cracked it, took it out. And it is my first molar, the chewing tooth, and I can't chew at this point. I placed an implant. I'm waiting it to heal. I can't wait in a few months to get a crown back in. It just affects my whole function myself. So the first option is what we call fixed teeth. That means that you have fixed teeth. God gave us fixed teeth, and we're going to get you as close as possible to God's work. That's where we take all of your teeth out, or if you don't have any teeth, place 6 implants, an average, 5 to 7 implants minimum, and it differs from person to person. We'll mention it in a second, and give you fixed teeth from day one. That means that you go 0 time with no teeth. You literally walk in, put you to sleep, take the teeth out, put the implants in, start the design process. It's basically 24 hours you have teeth in your mouth, and you actually, the next day you're walking around with fixed teeth in your mouth. Then you go for healing phase, then you get the final teeth in. That will get you to 95% of your function. You can eat whatever you want. You can eat a steak. You can chew, you can eat nuts. You can chew a corn in a cup. You're going to bite into an apple. No problems. You go to sleep, they go with you. You don't take them out. You don't put them in. They're just there for you. The only person who can take them out is the dentist. It's me. We screw them in, we screw them out. If there is an issue ever, sometimes we need to clean under them, maintain them a certain way. And materials are different. There's different materials. We do zirconia. Zirconia is a very strong material. It's like a white titanium. Think about it. It's a very solid material, and it should last for a long time. So that is option number 1. And that is actually the best option that you can get to. Now, I would love if everybody in this room get to that option. The only problem with that option is it is a big investment. It is a big investment as much as a car investment. So that's why we do have other options where you can actually try to get to maybe something better, something less, but still better than what you have. So that's where we go to what we call signature fit dentures, which is the second option. These are actually what we call snap-ins. So these actually teeth that have suction cups on them. We place implants in the mouth, and you put them in, they go in, snap, and then at the end of the day, you take them out. You cannot sleep with them, but they are good. They look fantastic. By the way, Carolyn, the lady who wanted to, have issues with committing suicide, and she showed you the steak challenge, she had the snap-on. She did not have the fix, and I put that on purpose just to show that you can still function, live. And she's been 10 years now. She's extremely happy with the teeth, all good. So the snap-ins will get you 60 to 70% of function of normal teeth. Meaning wise, you can eat food, steak, no problem. You don't need to take the teeth out when you go, when you want to eat. But you cannot bite into an apple. That's the difference. Corn in a cup, that's going to be a little bit challenging over there. So that's the major difference between these two. The look, or the cosmetic look, the first option is nicer. But I'll be honest with you, it's very close though. They look nice in general, both of them. So it's not like a huge difference. It's nicer. It's porcelain at the end of the day. The top, the bottom is more resin, so more like a different material, but it still looks super nice. The last option is either do nothing, stay where you're at, and things are going to deteriorate, or do dentures. I personally hate dentures. I don't like them. I don't wish them for anybody. Even if you're thinking of dentures, here is my recommendation. You can get upper dentures, but don't get lower dentures. They don't work. If anybody convinces you to get lower dentures, or if you know anybody who says lower dentures work, they're not telling you the truth. We see it backstage all the time. It just doesn't work. We don't do them. Signature Smiles, we do not do lower dentures because they do not work. The minimum we would do is actually implants with dentures in the bottom. Upper dentures will work. Ideally, what I like to do instead of going to dentures, try to keep the teeth as long as you can, because you're preserving the bone, and actually anything is better than full dentures. Okay? If you have any questions about that, please stop. All right, so that's the first option, the fixed teeth. That's how they look like. These are very nice, the fixed teeth. You could see the access hole. We plug these once we put them in the mouth. So if you see this photo over here, you could actually see that you don't see any holes in them. So we close these holes. The nice thing about these are very thin. They are almost the size of the teeth. So they are great for people who gag. So if you're a severe gagger, we have patients like extreme gaggers. These are actually great for them. They look nice, function good. These are the stable fixed one for them. Now, these are the snap-ons. This is the second option. So you could actually see they are bulky. They're more bulky than the first option. They're still a horseshoe, not just like a full denture. So it is better for gagger. But if you are severe gaggers, means like extreme severe gaggers, these may not be the best option for you. Just FYI, these are the ones you can eat and chew steak with them, but not corn on the cob. So let's walk you with our lovely patient here. So she came in and I see a question from Rob, how long after extraction to wait to get implants? You know, I read that you can get them right away or should wait 6 months. Okay, that's a great question. I'm going to explain it right now, so stay focused, okay? It is actually, so if we look at this lovely lady here, her name escapes me, I think Susan, I believe. I forgot her name out of so what happened, she hated her teeth. She doesn't like the way they look. There's a lot of cracking, discoloration. She just like, I can't do it anymore and I cannot function anymore. So we agreed on, and she's in the early 50s, take everything out and put implants. So what we do, go to sleep, take everything out. You will go no time with no teeth. So we will design your fixed teeth on the same day. You'll get them the either same day or next day. And basically you will go with 0 teeth. These will be the healing teeth. So you will have fixed teeth. And I'm answering to you, Rob, it is actually now proven that if you place the teeth on the same day or the next day, it is better for healing the bone. For example, these days we know that if you fractured your leg, for example, right? They give you the boots and they say just step on them slowly. Don't go play soccer with them. Just step on them. You actually will heal better. On the old days, you'll give you a cast, say don't move them, but that cause the muscles and the bone not to heal well. So that's why we like light pressure. So it's actually better to take the teeth out. We break the bone actually. We put the implants as fixation screws, and then we use the teeth as the boots, the fracture boots. And basically we just say, hey, you're gonna take it easy the coming 2-3 months, soft diet. So you're not allowed to eat anything you want in the first 2-3 months, but you will have fixed teeth to smile with. You will have fixed teeth to go around with. You sleep with them. You're good, no problems. But you're gonna be limited on soft tissue and the soft food. Sorry, you cannot eat hard food. You heal for 4 to 5 months, and then we actually give you the final teeth. Is that clear for everybody? So that's actually the teeth over here, and these are actually the healing teeth over here. That's actually, and that's the final teeth on this side. We usually like to take photos before and after the patient now. All right, who's in here heard about? Now let's get to the next all-in-4. Anybody heard about the all-in-4 concept? Say yes or no. I really appreciate if you guys answer. That'll be nice. Okay. Oop, 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 oop. How long you expect to be in pain? I love that. Okay. I'll come to that. The pain, I'll come to it. Yes, yes, no. Okay. So we had a couple of people heard about all-in-4 and some did not. So this is important to understand. So all-in-4 is a great concept. It came in the 80s and late 80s and 90s. And it means that, hey, listen, everybody in this group, we have 15 people in here. We take everybody, young, old, female, male, big guy, small guy, whatever. Take everybody's teeth out and put 4 implants in the top, 4 implants in the bottom, give them fixed teeth, and we're good. It does work, okay? The problem, though, with this, 4 implants, it's the minimum number of implants you will need. So you cannot build it on 3 implants. So let's say you got 4 implants. I just actually had a patient a few months ago. He had 4 implants 6-7 years ago, and 1 implant failed. What happened? You almost had to start over because it will not take 3 implants. So the problem with 4 implants, we take God's work, okay, on 13 teeth or 14 teeth, we go to the minimum amount of implants or anchors, 4 of them, and say good luck, okay? So we don't like that. I personally don't like that. I like to build my foundation and stronger anchors. And so at least if one implant fails in 10 years, I'm still having more support. So if I, for example, if I go build 6 implants for you and one failed, hey, I still have 5. I'm good to go. Plus, if you're 45, I mean, Rob is 45 years. If he's going to live till 90, that's another 45 years. I need to over-engineer the foundation. And in that way, 10, 20 years from today, something happened. One implant decided for any reason to fail, hey, I still have over-engineered it. If you go with only 4, the problem with that is one goes, you start over from scratch, basically. So I personally, we don't practice the all-on-4 now. If you're 80 years old, very thin, woman, and tiny one, you don't have too much forces. I'm good with that. Yesterday, I had a consult with a guy. I walked in, his muscles, I could see them from behind. Like I'm walking into the room. I could see his face, like his masseter muscles from behind. I was like, I'm putting 8 implants for this guy. I didn't even talk to him yet. I didn't see the guy's face. And I was like, this guy is getting 8 implants. We're coming to a minute. I love your question, Paula. I'll come back to that question. So that is all-on-4. That's what we do at Signature Smiles. That's what I recommend. Wherever you go, whether Signature Smiles somewhere else, you're getting 6 implants. All of our patients 6, 7. If I can put, and it's, by the way, money wise, it's the same investment. It's not, we're not like 4 implants, you're saving 2,000. No, it's just same. We don't care about the number of implants. You're getting 7 implants. If I go in there and I can put 10, I'll put 10. We don't do put 10, but usually we're talking about 7. You actually, the first one over here is she had 9 in the top. 6 is a good average for us. So for example, this guy over here, if one of these implants in the middle failed, nothing is going to happen. And we're good to go. I had a patient today, actually. I did her implants 9 years ago, 2 implants, and I decided to add a third one, a bridge, not even a fixed teeth. She came today, one of the implants just gave up. Great. I over-engineered it today, actually. I took everything out, taking one implant out. She still have 2. We're good. So that's fine. I mean, if I build it 2 implants, one failed, I'm done. I need to rebuild everything. So that's the story over here. All right. Now let's get the coming 2 slides are the most important ones. We'll talk about them, and that will answer most of the question that came over here. Am I a candidate for dental implant treatment? This used to be more question in the old days where people like in the early 2000s, if you're diabetic, if you're smoking, at this point, 99% of people can get dental implants. There's only a few, people who can't get dental implants. If you're on active, for example, chemotherapy or radiotherapy, certain medications. But generally speaking, if you're diabetic, we work with you. Yes, it can take a little bit longer because of the healing. Smoking will get a little bit, strict about, especially right after the surgery. We work with you for 2 weeks after the surgery. You can use like nicotine patches, but we don't want you to smoke like for 2 weeks. So but generally speaking, it's proven these days that implants will survive, tough conditions, but it does depend also on the patient compliance too. So that's one thing. How painful is getting dental implants? I believe who asked that question? Rob. So no. Oh yeah. How long you can expect? So if you are getting dental implants, you'll be surprised. We take the teeth out. We plug we use the implant as fixation screws, just like fractured jaw, and then heal. You're expecting to be in pain and some swelling and bruising for 3 to 7 days. That's why we give you strong antibiotic to prevent infection, strong pain medication to control the pain. And in that way, we bridge you through these like the first week. But generally speaking, after the first week, you just be fine. I mean, so the whole process, although it takes 6 to 8 months, it's literally there is 1 week that you're going to be wandering around, with some pain. And usually we say, this 1 week, you're not going to go to work. We give you like instructions, what to do, what not to do. And I will be honest with you, 50% of people, they have 0 pain. But there is 50% that have a lot of pain. Not a lot of pain, they will have a good amount of pain. So we tell everybody, because you may be at that 50%, But we hear 50% of patients, they show up, it's like, man, I didn't feel anything. It was fine. It's just like a simple, procedure, although it's a major procedure. So we bridge you with pain medications. We have a specific regime how to take pain medications and how to manage it. Antibiotic, we give you anti-swelling. Most of the time, you're gonna get bruises. So that's one thing about the pain. I hope that's enough to answer the Rob the pain question. Well, I need to have one implant for each tooth. No, you don't, but you need to bridge things. So if you're replacing 12 teeth, we like 5 to 6 implants. So it's almost for every 2 teeth, you're getting 1 implant, and we bridge them together. So if you're building a fence, for 12 feet, you're putting 6 anchors. That's kind of the story over there. I would like to answer another question here about mini implants. Somebody asked about mini implants. Mini implants, what is the right word to use? They do not work. And they're great for dentists who does not have the right skill and they want to do things quick and easy. And they last for 3 to 4 years. And they destroy the bone that we use for the regular implant. So think about what does mini implant mean. So it's basically, if you think about the implant as a screw, right? If you go very small one, less than 3 millimeter, it's called mini implant, the width, the diameter of it. And these usually tend to fracture because they're just very thin titanium and they just don't last. They cannot stand the power of function and mastication, and the long-term planning for them sucks. We're actually replacing, we had a patient from Florida. She got them down in Florida. The nice thing about them, they're cheap, but they don't last long. So, and you end up fracturing them, more problems. We don't recommend them. We don't do them. Many implants, it's just, unfortunately, it's easy to place, easy to lose. I hope that answered that question. And I'll be honest with you, there's nobody in this country who know how to do dental implants or an expert in dental implants recommend them. But there is always a market for anything, unfortunately. But it's not the standard of care. Let's put it this way. All right. How much does it cost? Everybody's waiting for this question. And will my insurance pay for this? Now here's my unfortunate. I would love if insurance pays for these things. I would try. I tell my patients. I had a patient. The patient I mentioned earlier. She had a disease. She can't eat. She can't chew. She lost a lot of weight. And her medical insurance, I have nothing to do with that. Her dental insurance says, the only thing we cover for you is dentures. You call your dental insurance, say, do you cover dental implants? They tell you, yes, we do cover dental implants. They're mainly talking about single implants. They're not talking about these big plans. So unfortunately, insurance does not pay a lot on these. And generally speaking, they don't play a major role. Their dental insurance, they think about that dentures are the route to go. So they will actually pay more money toward full dentures, but not toward implants. How much does it cost? It is a big investment. I'll be honest with you. This is if we're looking at let's go back here. So if you're looking about the fixed option, which is the first option, you are looking around, the average in the area, I would say you're looking around 23K to 30,000. That's your average. I'll give you that range. It's almost the price of a car for one arch. So that's for the top 30, like 25 for the top average, 25 for the bottom average. This is my recommendation. If you're going, like you say, you want to go to multiple dentists, some people do that. It's like, I want to go shopping around and see. I heard of places that they do it for way less. I just be careful with that, and I'll mention it why in a second, because we see a lot of these failures and they cause a lot of issues. Just like the patient I mentioned today. What happened? Sorry. Just like the patient I mentioned today, it's just too much to come back from. So just be careful about that. That's the average range for it. Now, on the second route over there is the snap-ons. The snap-ons, as I mentioned at the beginning, is the main thing about it is it's nice, price cut. So The only reason why we provide that is to give an opportunity for our patient to be able to afford it, which is probably around 15K from A to Z. That's including sedation, everything from A to Z. So that's usually your price. So your price range in the market should be from 13 to 17K. That's kind of the price, the investment that you're thinking of. So it is a big investment. And it's really, everybody, I always hear it. Well, I'm 60 years old and I don't want to spend that much money. So it's depends on the value and the need you want. And I always tell my patients, if you're thinking, it depends. If you can eat, function, happy with your smile, don't do it. If it's going to break the bank, don't do it. But if you want to be able to live with dignity and be able to chew food again and realize how much is be able to get back on track on how you live your social life, it is a big investment. Paula says, oh my gosh, the total cost was just a cardiac stress test. If you passed it, that's good. It is a big investment. And I will tell you, it is not a simple treatment. And that's how much free work God gave us. I mean, this is to be able to, that's why we try to keep teeth as long as we can. It's a major investment, but the good news is done for another 20 years. It is per one arch. The investments I mentioned. So let's say you need top and bottom. If you are thinking about top and bottom for fixed teeth, it's 50 to 60 grand. Yeah, so it is a price of a new car or a vacation. But you come back from vacation, you're in more, and you forget about it. You fix your teeth, it lasts you for 30 years. That's important to know. Most of our patients put their vacations on the side and don't do it. Most of our patients will delay purchase of a new car and will do their teeth. That's how, or they talk to their bank and finance it. And we'll talk about the financial options. For the snap ones, you're talking about top and bottom around 30 grand. So it is a major investment over there. Now, we'll come to that as well. Now, do we have financial options? Yes. So there is always, most of the patient, we don't, and by the way, most of our patients, I'll be honest with you, they are just normal people, just blue collar, normal people. They, affordability, it's not like they're walking around with too much money, but we always work with them around for either payment plan. We do have like in-house payment plan. We have a third-party payment plan that goes up to 6-7 years. So it's almost like a payment of a car. Some people, they fund it through their 401k. Some people fund it through their banks. It's just, that's, they find a way. Some people, they say, you know what, let me do the top teeth. I actually had 2 patients today. They did the top teeth and they're coming back in a few years to do their lower teeth. So they just stage it because they know they're at age 40 or 50 or 60. They know they have to start somewhere. So that's kind of it is a big investment over there. Okay. Now let's talk about a few more questions here. How long you've been doing? Oh, okay. So that's actually extremely important. 6 questions you must ask before committing to dental implants. The patient I mentioned today, her investment to fix her teeth because she had dental implants that failed, and now she's going back to fix them. She's talking about $80,000, $70,000 to $80,000, because recovering from failed implants is very expensive, because once the implant fails, it damages the bone. So if you want to get the implants done, please, I don't care if you come to us or go somewhere else, please make sure that you actually do them in a place that they know. And how you're going to know is by asking the dentist. You're going to invest that much money. You need to know who is doing it, what's their expertise. I like a patient today, she asked me like passively, she asked me the questions like, do you guys do this regularly? She even asked the assistant that. So, I mean, we do it. This is our daily job. I mean, this has been doing it for 15 years. So how did they learn it? Did they just went to a weekend school and weekend class or course and they just did it? It's extremely important. You'd be surprised, how many people place implants and not very well trained. Fortunately, this is sad to say that, but just be careful with that. So you need to ask these questions. Always ask about customized plan. I have 11, 15 people in here, 11 people in here. I cannot give you all the same plan. It's customized. I had to customize it to your needs. I had to customize it to your budget, how you plan it. So always ask about options. It doesn't work like one option fits all. Very important. Will I be awake for this? No, this is sedation. You'll be asleep. It's either me or you sleep. Both of us cannot be awake. So if you want to go sleep, I'm awake. If you don't want to go sleep, I'll go to sleep for that. This is a major procedure. It's major, 4 to 6 hour procedure. Surgery wise, sedation had to be done. Do you have a clinic in Streetsboro? Yes, we have an office in Streetsboro and one in Brunswick and one in Elyria. What kind of maintenance I need after I'm done? So this is actually an extremely important question. The main struggle, which is sad, and that's where most people does not realize. I have the patient today, she said, well, I want to go to Mexico and get it done. Well, that's good. I'm fine with that, but just make sure you find a good dentist. Plus, make sure that they maintain it well. Who's going to maintain it every time? If anything happened after 6 months, a year or two, my car today, actually, my wife's car broke, and she had to send it to the dealer after, a few years of buying it. You had to be careful that you had to ask the place if they do maintaining dental implants. Dental implant will fail. And if anybody tells you they never fail, if God's work fail in our mouth, our work will fail. Now, if you maintain it well, afterward, if you buy a brand new car and somebody tells you, you don't need anything, you just take the car and go for the rest of your life, that's a big lie. This is exactly, what's happening. You need a maintenance. You need to be seen every 3 to 6 months for a cleaning. Implants does not get cavities, but they do get gum disease. And you will have a failure if you don't get cleanings, maintenance, and somebody who knows how to handle them, identify them. I had a patient yesterday. Oh, I wish if I took a photo. Came in, went to a dentist, been seeing a dentist, could not identify a failure of implant. He came in, I took the implant with my fingers. I was like, man, if I saw you, maybe 3-4 years ago, we could have saved this implant. So maintenance is important. A lot of places, they do the procedure and they ship you out. They say, you know what, we're done. Like, what do you mean I'm done? Like, who's going to maintain these? Oh, I just go to your regular dentist. Most dentists does not understand dental implants. So just be careful. You had to find a place where they do the procedure, maintain it. You'll never buy a car that does not have a dealer, or you don't buy a car that doesn't have a dealer in the United States, for example. So you had to be careful with that, or doesn't have parts or pieces. Are you providing a lifetime warranty? No, we don't. Some places do provide lifetime warranty. And guess what? I personally believe it's a BS. And I never signed up for a lifetime warranty, and I always fails. Like, you get a lifetime warranty in a tire, and then something happened. Well, this is different than what we told you. Nothing is lifetime warranty, but you need to have a good warranty. A good warranty, probably 5 to 7 years. FYI about dental implants, here is the trick about dental implants. They problem starts after 2 years. So most dental implant problems start from 18 months to 30 months after finishing the treatment. That's why you had to stick to the same practice. Because if you go to a practice and say that you go somewhere else to maintain it, and you moved to Florida, for example, and thinking everything is fine, it hits you after 2 years, the problem. So you had to kind of stay around the place that did it. I mean, you can move if you need to relocate. It's a different story, but just FYI. So, but you need to, at least any place who's doing it for you, they need to have 5-year warranty minimum. That's what we do. We do 5-year warranty, no questions asked. Anything happened to dental implants, no questions asked. They could fail, we replace it. We needed extra bone graft, we replace it. We needed this, broke, something happened, we replace it at no charge, nothing. And if you pass the first 5 years, you're good to go for the rest of your life. Okay, I would not say the rest of your life, for 20 plus years. Okay, that's important. How much does it cost? We answered that. Now, all inclusive or per procedure, this is important. So we talked about the money, right? I hope that you guys taking notes about this. You had to have a number, like before you start the treatment. For example, my wife delivered the baby, literally, this is a true story, and I'm still getting bills. I don't know, it's been like, my son is what, 7 years old now, and he's still getting, I was like, why they're sending me all of these bills? Give me one price and I'm done. So you had to know, if I say, listen, Paula, your treatment is $30,000. It's $30,000 done. You need to know that number. And I promise you, Paula, I'm going to get you from A to Z. I don't care if something failed. I don't care if I needed to use more instrument, more bone grafting, more implants. If I put 10 implants, 7 implants, whatever that is, it is all inclusive, vacation. That's it. So you had to know that implant procedures can add up pretty quickly. A simple add of a bone graft is 2 to 3 grand, period. So it's not like a couple of $100s. One implant failure could cost you $3,000-4,000 to repair. So just be careful about that. Okay. Now, sedation. This is Kalmish, the godfather of implants in the whole world, actually. Passed away in 2018. We're trained under his training. That's when we actually train dentists to place dental implants. They fly to our Streetsboro location from all around the country. We usually do like 40 procedures a day. This is our steak challenge where our patients send us, steak challenge videos, and that's what we finish. So it is 7:22. I try to get as much as possible. Let's be able to answer questions. Any questions so far? And I know I went like quick. There was a question I did not understand. Laney, is that Laney? Are there only full or singles, or they can made as partials? I don't understand that question. If you can clarify, I would love to answer it. Any other questions over here? And before, okay. And before, as we're waiting for the questions, I want to say one thing over here. We do have an offer for everybody on this call that if we do a complimentary consult for you, which is basically everything that's needed, like a full 3D image, CT scan, a review, full set of X-rays, a full plan for you, and that's it's a complimentary at no charge. You meet with one of our doctors, either at Brunswick, Elyria, or our Streetsboro location. They go through all of that and give you an idea exactly how much it costs and go through options more customized to you. You can actually, Misa will put her phone number over there. You can call her, text her, and she can get you scheduled with that. So basically, it is a complimentary consultation for everybody on this call. Usually that complimentary consultation does go to $750 for all of our patients. So this is one thing that we offer. All right, let's go back to the questions now. I see a couple of good questions coming in, which I love. It is such a pleasure to listen to oh, thank you. It was nice meeting you, Paula. Thank you. Have a partial in the bottom. Can you get second option as a partial? If I understand what you're saying, you had a partial attached to teeth. Can you add implants and attach the implants to the partial? If that's your question, yes. If you want to get more stable partial denture, you can actually add 1 or 2 implants and do the snap-on plus the teeth. Does that answer your question? I hope so. Okay, great. I'm glad that I answered your question. Now, usually we evaluate the rest of the teeth, and here is the point. Problem with dental implant, they are expensive, so we can we can do that, but we had to evaluate the rest of the teeth health. The rest of the teeth health are not in good condition. We don't like to do a patchwork with expensive implants, right? But that's an option that we can add implants if you have the right amount of bone and it would clap to the portion 100%, especially if you have metal partials, and that actually can avoid the metal showing in your teeth. So actually we can snap in and avoid the metal showing when you're smiling, for example. Some patients do that. If you need I see Paula, you can, okay. Any other questions? I'll keep it to the questions now. If you ask any questions, I would be happy to answer them. Hey, Misa, can you go back through the first list? I know that you have why they joined. I don't have that. I lost the messaging when I lost the connection for a second. The early, can you share it?
Yes, absolutely. I can go ahead and send that over for you so you can
Please.
see some questions here.
Yeah. Any other questions? All right, we have one. Yes, thank you. A lot of food for thought. And that's the point of these seminars that we do. It's food for thought. Get some education. A lot of people, unfortunately, get misinformed, and I'm glad that I was able to add value um, to everybody. Okay, we'll give it another 20 seconds, and if no more questions, then we'll wish everybody. So I have dental implants for one dental implants for upper teeth. I hope that answered the question. Interested in full mouth implant or at least the uppers, okay. Affordability, we talked about the money. I want uppers too. Price for everybody is looking upward. By the way, something I did not mention, upper teeth, they are the most important ones because they are actually plan the whole design, the smile and everything. And we usually like to start with the top. If we want to prioritize, we always start with the top, then we move to the bottom. Insurance contribution, we did talk about that. Unfortunately, insurance doesn't help much. Implant process and how expensive they are because I know they aren't cheap. Okay, so I hope I answer everybody's question. And David, thank you. As I said, if any questions, you can call Misa. She's available right now at 330-949-1029. We can get you scheduled for our Brunswick or Streetsboro location, and we'll go through everything and take it from there. Thank you, everybody. And I wish everybody a wonderful night and enjoy the nice weather out there. I know some rain is there, but at least it's nice. Have a good night, everybody.
Thank you so much, Dr. Omar, and thank you to everyone for attending today's dental implant seminar. Please feel free to reach out to me at 330-949-1029 so that I can help you in scheduling your complimentary implant consult, and I will be more than happy to help. But thank you so much, and I hope that you all have a lovely rest of your evening.
Thank you, everybody. Good night.